Are you having recurrent ear discharge? You have been taking medicines for a long time now, but the discharge comes back again and again. You have been to an ENT doctor who has told you that you have a hole in the eardrum. Now you have to undergo a surgery called tympanoplasty. Now this might sound very intimidating, but relax. It is a very safe and simple operation to make your ears healthy again. Hi, this is Dr. Debayan Tarafdar. I am an ENT and Head Neck Surgeon working in Kolkata. And this is the part 1 of a series that I call Ear Surgery Explained, where I will explain about few common ear surgeries for your better understanding. And today's topic is tympanoplasty. So before discussing the surgery, we should know a little bit about the ear anatomy. Our ear has 3 parts: external ear, middle ear and internal ear. The barrier between external ear and middle ear is our eardrum. Our eardrum has 2 functions. One is to vibrate with the sound so that we can hear the sound. Second thing, it is the only protective barrier that prevents anything from external environment to enter the delicate middle ear. Think of the eardrum as the front door of your house. Now, what if there is a big hole in the front door? What will happen? Rainwater will come inside, dirt and dust will come inside, and it will make a mess in your living room. Similarly, if there is a hole in the eardrum, the dust, water and dirt from outside can easily enter the delicate middle ear and cause infection, and that gives rise to the recurrent discharge. Now coming back to tympanoplasty. Tympano means eardrum or tympanic membrane. Plasty means to repair. Tympanoplasty is the procedure in which we repair the eardrum. Think of it like patching a leaked tire. Why we do tympanoplasty? 1. To restore the hearing. A perforated eardrum cannot vibrate properly, hence hearing decreases. Once we patch the perforation, the hearing improves. Secondly, to restore the protective barrier so that the middle ear is spared from recurrent infection. The surgery is usually done under local anesthesia, can be done under general anesthesia as well. Most of the patients will be discharged on the same very day. In some patients, we can keep them overnight for observation and discharge the next morning. In this surgery, we take a small amount of tissue or graft from your own body to patch the hole. The most commonly used graft is the thin tissue that covers the temporalis muscle, that is the muscle behind your ears. We can also take ear cartilages for grafting. The graft is placed to seal the defect so that the remaining part of the skin of the eardrum can grow over it and heal the eardrum completely. There are 2 main approaches by which we can do this surgery. One is postaural, where we make a small incision behind the ear. Another one is endoral, that means incision inside the canal. Nowadays, with endoscopes, we can do a completely scarless tympanoplasty without making a single incision outside. So how will you feel after the surgery? First of all, there will be a turban type dressing covering the ear after the surgery, which will be taken out 4 to 5 days later. Nowadays, with endoscopic tympanoplasty, we give a very small dressing, which is much more comfortable than the previous mastoid type dressings. The pain is not a very major complaint after this surgery. Even if pain is there, that can be easily taken care of with medication. So what are the risks associated with this surgery? Risks are very minimal for tympanoplasty. First of all, giddiness can be there in some patients, which usually resolves in 2-3 days. Secondly, they might feel change in taste or metallic taste after surgery for a few weeks because there is a nerve which is called chorda tympani, which resides inside the middle ear. In very rare cases, there can be decreased hearing after the surgery as well. But all the complications are very, very, very rare. So what you should do after surgery? First of all, you have to protect the ear from water. Even after the bandage is out, whenever you are taking shower, you put a plug of cotton with the layer of Vaseline on top of it so that no water can go inside. Second thing, after surgery, you might feel the ear is clogged. That's because some medicated gel foam is kept inside. Don't try to pop the ear. Third thing, You might feel itchy sometimes. Don't try to poke or do anything to the ear. Other things you cannot do after surgery is 1. Blowing your nose, 2. Lifting heavy weight or straining in the toilet, 3. You should avoid flying for at least 4 to 6 weeks. So plan your travels accordingly. If you have any problems, please show it to your ENT surgeon. So this is tympanoplasty in a nutshell. This is a very safe and very simple procedure to restore your hearing, to make your ear dry and healthy again. So don't be scared if your doctor tells you to undergo tympanoplasty. I have more videos on ear surgeries coming out, so stay tuned for that. If you found this video informative, please like the video and share it to your loved ones. Please subscribe to the channel, that helps a lot. Stay healthy and I'll see you in the next video.